Now to a prescription medication used to treat type 2 diabetes. It's flying off pharmacy shelves after its side effect of significant weight loss recently went viral on social media. Now, this is causing a shortage, though, of that drug for those who rely on it to manage their diabetes. I sat down with Dr. Lou Casaban for some insight.
First, let's just talk about what this drug is meant for and who it's meant for.
Yeah, so the drug in question is Ozempic. Ozempic is a drug that's been out for several years now, very popular in patients who have diabetes because it slows down the absorption of food. It causes the body to produce insulin, and probably most to the point today, it suppresses the appetite. And this is the feature that other non-diabetics are trying to capitalize on.
And so you just referenced that people are using it for weight loss. Is that safe? Is that what it's meant for?
Yeah. Is it what it's meant for? No, unfortunately not. It can be effective at losing weight. So a lot of these patients with diabetes do end up losing weight, and I think that's where the spark came from for people to use it. But with any medication, especially something like Ozempic, there are some inherent risks. The most common side effect or problem with Ozempic is that it can cause nausea, upset stomach, and people just to feel run down. In some patients, it can cause an irritation or inflammation of the pancreas, especially if mixed with alcohol. Or someone has really high cholesterol. And then the other component is the fact that the weight loss or whatever happens while people are on the medication gets undone as soon as the medication stops because of there's not change in diet and exercise or continuing efforts. So it's a temporary gain or solution with some real side effects.
So now, because people are using it to suppress their appetite for weight loss, what are your patients seeing? Is there a shortage, or could there be a shortage in this medication?
Yeah, as of a couple months ago, we started to notice some phone calls from our patients who are on this medicine, our patients with diabetes that are on this medicine, saying, hey, my pharmacy can't supply the medication, they're short. Can we send the prescription to this other pharmacy? And over time, it just became very apparent that something had changed.
And what are you telling your patients who are looking for this medication, who actually need it? What are you telling them?
We're a center where we see a lot of patients with diabetes. We oftentimes find out, oh, try this pharmacy has it. Sometimes these patients are having to call multiple pharmacies to try to get the prescription fills and then call us back so that we can get the prescription sent to the appropriate place. Some patients, unfortunately, will have to reduce their dose or take a lesser amount or go without if they can't find it, which is a very dangerous proposition for someone who needs this medicine to control their diabetes.